Sorry, hi everyone. Okay, talk about getting caught. Anyway, good afternoon. How's everybody today? Hope everyone's okay. All right, today we are on Doctors Go Live, and we have with us Dr. Yoga Raj, who is the Consultant Orthopedic Surgeon at Columbia Asia Hospital, Iskandar Puteri. Hello, Doctor. How are you?
I am fine. Good evening. Thanks for inviting me.
No problem at all. It's such a pleasure. Okay, we're gonna be talking about the topic of arthritis because wear and tear are inevitable to every part of the human body. So we have joint pains and more commonly known as arthritis, which is agonizing and disparaging, as tender joints tend to keep you awake at night and it gets in the way of your mobility. Okay, obviously it didn't get in the way of my mobility as I was rushing now to switch the thing on, but we're all good now. So let's address this matter right away. Okay, Dr. Yoga, maybe you can let us know how would you describe arthritis?
Okay, let's go to the first slide. Thank you for the question. First of all, osteoarthritis is very commonly misunderstood. A lot of them go to pharmacy, they say I have osteoarthritis, I have osteoporosis, and they confuse each other. They are completely different. Today I'm talking not about osteoporosis, but osteoarthritis, which is a joint.
Okay.
All right. And we know the joint is the moving part. Like your normal door, it's very smooth. But when the door is old, when you open the door, you have noise and close back. So it's very
Right.
noisy. The joint is very, very smooth. But some things can make it worse. Right? For example, let me show you the pictures. Next slide. This is a picture showing a microscope cut section of a joint. You can see the joint spaces there are equal and they're nice and rounded. Next slide. They are made of very, very small cells, which actually made of water, and they are shock absorbers. These are your body's shock absorbers. But over time, like a car tire, when you use it, the shock absorber becomes thinner, lesser, and the bones knock each other. And that's when the patient says as pain is noisy and comes to look
Right.
for doctor.
I see.
Right? Next slide.
Okay.
So this is what happens to a joint which is damaged.
Oh,
Right?
that looks
You can see
painful.
the top bone, the bottom bone. You can see the red areas, which are areas where the shock absorber or the cartilage is worn out. So
Yeah.
osteoarthritis means the cartilage is gone, and because of that, the underlying bone knocks each other. And when bones knock each other, it's painful. Next slide. Okay, so just a selection. If you look at the left side, you can see a nice white pristine joint. Whereas on the right side, you can see the white thing, but there are things missing in the center. And these are the areas of bone which are disappearing due to osteoarthritis. Next slide.
I see.
Okay.
Why does arthritis occur? Maybe you can explain to us the causes of arthritis.
Okay, osteoarthritis will occur to almost every human being. And one of the commonest cause is actually wear and tear. And of course, if you're older, you probably walked longer, done more things, and the joint has been used more. And therefore, its aging is one of the reasons. But of course, there are things that are more than aging. For example, you may have injured a joint. You may have fallen down from a step. You may have an accident. And therefore, the joint is no more as good as it used to be. Let me just show you. Next slide.
Okay.
So you can see the left knee joint. You can see the joint with nice white things there. Whereas on the right side, the white cartilage is eroded and the extra bone growing. So the knee will now look deformed, shaky, and of course it's painful. Next slide.
Doctor, the extra bones that you were saying just now, this is something that occurs, it's inevitable. It will definitely happen as you age.
Well, when you lose cartilage, the body wants to replace cartilage, but the body cannot replace cartilage, so it replaces bone. But bone
I
is
see.
not as
Okay, that
smooth
makes
as
sense. All
cartilage.
right.
Therefore, it's painful and it shows a deformity. For example, the picture in front of you, the slide, shows you on the left side, the blue areas. This is the cartilage. When the blue area is gone, you have the bone rubbing, and the body will then produce extra bone. And these are known as spurs. And in osteoarthritis, you have more spurs. Next slide.
Okay.
Okay, so this is how a normal cartilage will looks like.
Right.
And next slide. And this is what will end up when you lost all your cartilage and have bone spurs. Let me just remind you, just say if you drive a car and your tire is worn out and you still continue driving, you see the metal coming out, and that's very dangerous. Same as this, the white layer on this bone is gone and you just see raw bone. And this is painful to look at, even to look at.
Yeah. Doctor, this one could possibly have belonged to a person who is in his or her 50s, 60s. Would you be able to tell?
I can't tell. All I can tell you is whatever cartilage this patient had is no more there. The
I
age
see.
is one of the risk factor. That means it may have been from a 70-year-old person, but it just tells you the cartilage is gone, more likely from an older patient.
I see. Okay. All right. Let's take a look at what's next.
That's right. Yep.
Yeah, okay. Arthritis, because we always hear the elderly especially, and apparently I have even started complaining about joint pains, so go figure. How common is arthritis in Malaysia?
Okay, if you look at the statistics, if you are over 80 years old, 80%, if you are over 75 years, then 8 of 10 of your classmates will probably have it. And it's 80%, very high number. Whereas we are younger, about 65 years, only half of them will have osteoarthritis. So just by numbers, the older you are, the more likely you have osteoarthritis.
I see.
Next slide.
Under age 45. Oh, okay.
Yes.
Sorry, I'm going to go through that. Who is at risk of getting osteoarthritis other than age? What are the other criteria?
This is most important to everyone else. So aging is something you cannot change. There's no doctor who can make you younger. There's no medicine that can make you younger. So we have to face it. But there are things we can do. First of all, previous injuries. So when you have your friend or your young guy going on a motorbike without all the protective gear, or a small boy riding a bicycle without all the protective gear, then you know if they fall down and they injure the knee, in the future they're going to pay the price for it.
I see. Okay.
Those hell riders, the one motorcyclist who drive very fast, hit here, hit there, cut here, cut there, and break their bones, they are at risk as well. Okay.
Yeah.
Or if you have any infection, especially around the joints, then it's also a risk factor. Now coming back to something more common, food. Every Malaysian loves food. You like to go for food, a lot of meat products, blood, all of food which has a lot of protein. All right. And if you have a disease called gout, then the protein will be absorbed by the body, and the byproducts, which is uric acid, will be in the joint. And this thing can also damage the cartilage of the joint. So food also can destroy your joint. Now, of course, if you injure yourself from some kind of bleeding tendency or from trauma, that also can damage the joint further. For example, this next slide is quite painful. Let me show you. This is an injury. Next slide. You look at it. This is actually a rugby player. Just look at the guy in green. You look at his knee joint. That knee joint is bent too forward. And that's really due to the injury at that time with all the ligaments being torn. He will have pain now, but he will pay this injury all through his life because of this trauma. Okay?
How is this connected to arthritis? Like the injuries that you have now, from the list that we saw just now, it will increase your risk of getting arthritis.
The knee is a very nicely balanced object. When you bend the knee too much, the tissues in the knee joint will tear. They will not heal fully. Because of that, the knee is not aligned properly. Over time, because of malalignment, the knee will wear out faster than the normal knee. And therefore, you get osteoarthritis earlier, much earlier than 65 years.
I see. Okay. All right. Okay. Let's take a look at the next one.
Now, this is more common, very worrying. A lot of kids these days are bigger, they eat more, they have better milk, they are more bigger size and usually obese. Because when you're obese, you put a lot of weight on the knee joint. All right? When you take a normal step, every time you step on the ground, your body weight, 3 times the body weight is put to the knee joint. When you run, it's 7 times. So a patient who's obese wears out the knee joint faster than a normal patient. So
what if you need to go downstairs?
Sorry?
if you need to climb up and down the stairs, is that something that will also erode your what? Something like
Yes
that.
and no. If you go up and downstairs, the moment you put your
Yeah.
leg down and go downstairs, a big impact. If your
Mm.
joints are strong, your muscles are strong, it's good for you. But if your joints are
Mm.
not strong, you rely purely on the cartilage, then you wear a joint faster if you do all these extreme
Okay.
sports.
For someone who's got bad knees or a risk of arthritis, is it more dangerous for that person to be climbing up upstairs or climbing down, going
Okay.
downstairs?
Usually, the joint is most put at stress when you go downstairs because your body weight is topped by the step. So
Right.
going downstairs is worse.
Okay. I see.
Next slide.
Roger.
All right.
Examination. What's this
So
about?
now all of you all are worried. Do you have it or not? There are very simple ways for you to find out if you really have arthritis. Very simple. First of all, if you stand up straight and you put the legs together, the feet together, if
Okay.
there's a big gap in between your knee, then something's wrong. For example, this picture, you can see the leg has got a gap between the knee joints. And this is called a varus knee or bent knee or bow knee. And this tells you the knee is not well balanced. And this is one of
Right.
the ways to look for osteoarthritis. Next slide.
Mm.
Sometimes due to injuries, the knee cannot straighten. When you stand straight, it looks like this, like you cannot stand properly for an assembly. And this means the knee has got some issues that prevents the joint from standing straight. This also means that you might have osteoarthritis. Next slide.
Okay.
Another example, if you are a footballer or a goalkeeper, the
Yeah.
ball will go right through. All right. So this is also a bow knee, which tells you that something's wrong with the knee joint, and more likely it'll be osteoarthritis.
I thought this is something that bow-leggedness, I thought is something that you are born with, but you can also develop bow-leggedness.
You may have a normal knee, but over time, because the knee wears out in certain areas, you get a bow knee or a knock knee. It tells you the knee is no more aligned.
I see. Okay.
All right.
Patient problem. Sorry, doctor. When you were mentioning about the examination just now, basically that's how you come up with diagnosis.
That's how the patient will come to tell you that the knee is abnormal. The
Okay.
patient will
So
say
that's how the
knee is
patients can tell whether they have a problem or not.
correct.
Okay, but will we be talking later about how what are the procedures that would be done onto the patient in order for you
Yes.
to diagnose? I mean,
Correct.
other than X-rays lah. Okay, all right. Yeah, we'll wait for that time. Now let's talk about patient's problem. What usually would
that-
be complaints by patients when they come in and see you?
The first thing they tell you is pain. Pain, pain, pain. Pain when sleeping, pain when walking, pain when doing work, and they find the knee is stiff or knee is unstable. Or it's
Yeah.
noisy that their neighbors or their spouses say, lutut tu sangat bising, very noisy. Okay? And they have pain and they feel embarrassed because every time they walk, they look like something's inside them, which is making noise. Very worrying. Next slide. Okay. This is something I tell all the patients do. Do it yourself now. Look at your hands. Look at your own hands. All right. If you look at your hand, there are many joints here, but look at the end of this. If you see lumps in this area here called Herberden's nodes, these are indicative of wear and tear everywhere in your body because fingers also have got joints, and this indication tells you have osteoarthritis in your body. So your own hands will tell you if you have osteoarthritis.
You mean something that looks like bengkak lah?
Bengkak ni, bengkak dekat sendi, that will tell you that the joints are not normal, which is spur. Same as the knee joint, the hands as well. So even though it's not painful, having these notes down here may show you a clue that you may have osteoarthritis. Just look at the hands.
Okay.
Next slide.
Oh, is X-ray the only way to find out whether one has arthritis?
So we mentioned about patients' morning pain, stiffness, deformity, and of course the symptoms. So that is what patient will feel. But how do I prove you have osteoarthritis?
Correct. Yeah.
So the simplest way is a very basic X-ray. Next slide. So X-rays will tell you if the joint got cartilage or no more. So you look at it on both joints here, on the left and right. you can see that the joint has got decreased space between the two bones. The top bone and bottom bone are almost touching. That means the bones are rubbing. When they rub, they cause a lot of friction and pain. And that can be seen on X-rays. Next slide. The body will try and repair, but as I told you earlier, they cannot repair cartilage. They put on bones. If you look at the joint there, you can see two sharp things, macam tanduk keluar. All right?
Yeah.
That's very, very painful. And that's one patient say the bone looks deformed, it's painful, when you press, it's painful. And this is actually signs of osteoarthritis for joint.
Are these called spurs?
Yes, these are called spurs.
All right. Okay.
Most of the time, the patient won't come and see you and continue walking. Eventually, the top bone and bottom bone will knock each other until the patient cannot bend and has got a deformed joint. All right?
There are people, for whatever reason, they don't want to go to the doctor and find out what's wrong with them, and this will only make things worse.
Correct. Many patients are worried. They hear stories that it may not get better, it becomes worse. So they fear themselves. So our idea is here to explain to you why you have this deformity, and it will not go away. And it's better for you to treat earlier rather than later.
Yeah.
Okay, next slide. So what can be done? All right, so there are a lot of things you can do. Let me start with the basic one first. First slide, next slide. Okay, so again, there are two methods. One is by medication, one is by surgery. Okay, non-surgical or surgical treatment. Next slide. So what are the non-surgical treatment? This is something that is very, very important. Continue. Of all things, I want to tell you today, exercise. No matter what you're doing, exercise is important. All right?
Okay.
So the idea of exercise is to build up your muscle. Now, the patient that doctor...
This is to treat... Sorry, this is to treat the arthritis. This is not what you need to do before you get arthritis. Because if you're talking about exercise, wouldn't it be a bit tricky for those who are already feeling pain?
Okay, thank you so much. I wanted you to ask the question. Thank you. This is a very important question. First of all, exercise helps you before and after you get osteoarthritis. If you don't have osteoarthritis, exercise makes you have strong muscles, and these muscles support your bone better.
Right.
If you have osteoarthritis, the muscles also support the joint better, so it doesn't get deformed that easily. All right? Okay. But that's one difference. Don't say Dr. Yoga said must exercise, today I go and exercise. Because the exercises have got different effects. For example, if you go have a knee pain and ask you to go jogging, you say, doctor, saya tak boleh jogging, lutut saya sakit. But what can you do? You can actually do either swimming or cycling. These are good exercises that don't damage your joint, but still exercise the joint. All right?
Cycling is okay also. Wouldn't you need to, doesn't that stress?
All right. But remember, when you sit on a cycle, all your body weight goes on the bicycle seat, most of it.
I see. Okay.
If you walk, you put all your body weight in the joint. So you want to use exercise which does not put weight on the joint, so the joints can still move, but don't put load. Like just say your car tire botak. Don't take your car full of people. Less people. It lasts longer. Same logic.
Okay.
All right? Next slide. Right. Okay, so swimming. No matter what you are, swimming is very good if you can swim. If you can't swim, even walk in water or tread in water is also good enough. Okay. All right? Cycling, a lot of people have taken up cycling nowadays. You look at the news, they want a special cycling lane for Malaysians. Yes, it's a good hobby. The exercise helps you do things. First of all, it gives you fresh air, makes your muscles stronger, gives you healthier bones. So it's a very good exercise to have. Next slide. Now, if you have arthritis, already have early arthritis, then a few things will help you, either hot or cold pack. The first thing I'm going to ask you is why I use hot and cold. Am I right?
Yeah.
Right? If you injure a joint, when I use hot and when I use cold. Yes. So the idea is very simple. If you have a knee pain, fresh, new knee pain, just happened a day ago or 2 days ago, then ice pack will help you because ice cools down the joints, reduces pain. After 2 weeks, You want it to heal.
Mm.
So you want to put warm pack to increase the blood supply so that the healing can occur. All right.
Okay.
So in new cases, ice. In older cases, warm packs.
All right. Got it.
Next slide. Okay. Now, this is things that people get more into. For example, you have knee pain. If you use a nice shoe, not the beautiful ones, the one which is got good shock absorbing, the one which doesn't look, it looks ugly, like running shoes, jogging shoes.
Yeah, I've seen those. Yeah.
Those are shoes that absorb the shock. So when you step a step, it cushions your joint, so it's not so painful. So invest in a good shoe. All right, you can put a knee brace, a knee guard, will help to protect your knee slightly. Okay,
Right.
and then if you're having more pain, you can use a stick, walking stick.
Mm.
A lot of patients say, Doctor, malu nak jumpa. So I said, don't worry about it. You can use payung, an umbrella, use a walking stick, so you don't have to be so embarrassed. Because these are all ways you can reduce the joint damage as you grow older in life. Okay. Next slide. Okay, so examples. The shoe you see is not so pretty. It's not the high heel with 6 inches or 5 inches high heel, but it actually absorbs the shock. So you have knee pain, then dapat tanya selera lah. See, if you think that you have knee pain, you have to sacrifice something.
These are actually very cool shoes.
They are cool. Some people don't like it because it doesn't look beautiful. It doesn't go well with your dresses or with your baju raya, right? It doesn't look so cool, but it actually helps the joint. The middle part is actually a knee guard. It just helps you to hold the knee a little better. Doesn't cure the problem, but gives you some pain relief. And of course, the tongkat, the right side, the canes, will help you to offload your joint so you don't damage the joint further as you go along.
Doctor, sorry, just now we were talking about the exercises, right? What about dancing?
Okay, now going back again, you want to use your joint without putting weight on it. Okay. So if you're talking about dancing, jumping, then you actually going to put steps, so it will put a lot of load on the joint, so the joint will have a bit of pain.
Okay.
Okay. Now
what
let
if
me
you use the knee guard?
Sorry.
What if you use the knee guard?
Yeah, it will help you slightly, but still the weight will go to the joint.
Okay. All right.
But let me put it this way. This is very important. If you choose between watching TV, sitting down, eating some burger, watching TV, and dancing is better. Between dancing and cycling is better.
Okay.
Between cycling and swimming is better. So any activity is good. Certain ones are better than each. Do you get it?
Right. Yeah. That's a perspective.
Okay. So again, this is the key point for people in the Asian region now. When you're putting on more weight, weight reduction is one of the magic treatments that will work for most patients, even if you have osteoarthritis or going to get it. So no matter what I say, this is the most important slide today. Losing weight when you're big size will actually help you to reduce knee pain. And the exercise, as I told you, the food management will make you lose weight better.
5 pounds can actually make a difference already.
Let's put it this way. 5 pounds for you equals 15 pounds for the knee joint when you walk. So it makes a lot of difference. People who have lost 1 or 2 kilos suddenly feel the knee pain is much lesser. Two things, because they are lighter. Number 2, they have exercised and lost weight. So those two reasons in combination makes the patient feel they're better and gives them incentive to look even further.
Right. Wow, even that much weight loss also can make a difference.
Yes. So don't think it's meager. Even 5 pounds is easy to do it, but it makes a lot of difference for you.
Right. Okay, so that's not going to be too hard to do after all, because if we're talking about 1 kilogram or 2 kilograms, that sounds doable.
The starting is the most difficult part.
Yes, correct. It's always that. Once you get the momentum, then inshallah everything okay lah.
Yes. Talking about my experience as well. Next slide. Okay, so follow the weight scale. Yes. Now, if you go to a pharmacy and you say pain, knee pain, this word will show up, glucosamine.
Do these actually work?
Well, glucosamine and chondroitin and MSM are all the supplements we have that will improve the knee quality.
Okay.
Now, tell me you have knee pain and take this for 1 month, the pain will not go away. You need to take it for a long period of time. It means about 6 months to 9 months before you can even see slight improvement. And these supplements only work if you have early or mild osteoarthritis.
I see.
Okay, once it's bad, this don't help anymore.
But together, like you have to take both glucosamine and chondroitin.
They have better effects when they're together. Taking
I
one
see.
alone also is okay, but both
Right.
alone give you better benefit. But remember, the priority is not glucosamine. Weight loss first, exercise
Yes.
second, third only
Right.
supplements. So if you take supplements first and then hope for the rest, it's not going to happen. Weight
Yeah.
loss, exercise,
Shortcuts.
main two. No shortcuts.
Right. Right.
Next slide. All right. So this is actually a pharmacy. You can see everything you see in this place it's from USA is
Mm-hmm.
purely for joint supplements. And if you see so many joint supplements on the shelf, it tells you only one thing: they don't work very well. That's why every company comes with something new. All right.
Mm.
There's no perfect medicine which you take and tomorrow joint pain goes off. It back to the basics. Do
Yeah.
not hope on a supplement. It's our own hard work which will reduce the pain. Your
Right.
shoes, your walking stick, your exercise, your weight loss, all these are more effective than the whole pharmacy.
Yeah. Of
All
course.
right.
It's lifestyle. It boils down to
Correct.
lifestyle.
Now, just say you already have osteoarthritis. Now, this is
Mm.
very troubling. You go to work, it's painful. You walk,
Yeah.
it's painful. You sit on the floor, it's painful. So you
Mm.
want to continue activities because that's how you live. I need to go to work. So the first
Mm.
thing you can do is buy the medications that actually help you to cool a joint down. There's a lot of things
Right.
like Flexitech, there's menthol, there's a
Mm.
Floren gel. So these all drugs here
Mm.
seem to give you a local painkiller, which doesn't affect your stomach or your kidney, but
Right.
still gives you some pain relief. So these are safe medications, except for those who are allergic to the drug.
Yeah. But these are only temporary lah. It's just
Yes,
manage
these are
arthritis.
only temporary. They do not cure the problem. So you will
Yeah.
still have knee pain when it wears out.
Doctor, sorry, because we've been talking a lot about knee pain in arthritis, but arthritis also affects other parts of the body, other joints like elbows. Okay,
Okay, thank you so
joints are.
much. Yes,
Mm.
arthritis occurs in the whole body, from the hands to the shoulder to the spine to the hip to the knee to the ankle. The
Okay.
only difference is we don't walk on our hands. So when you
Yeah.
when you move, our weight doesn't go through our hands. So even if you have
Right.
arthritis or elbow, you can
Right.
still get away with it. But if you
Mm.
have arthritis of the knee joint or ankle or hip joint, then you
Mm.
can't move. So yes, you can arthritis of any joint in the body, but the
Mm.
most symptomatic will be for knee joints in the Asians and hip joints in the Western population.
Oh, why is that?
Well, it might be the requirements. You see, a Westerner may not want to sit on the floor. They don't have to
Ah,
squat.
okay, that makes
They
sense.
have
Yes.
Yes, whereas Asians would like to sit on the floor. Your prayers, Muslim prayers, you need to
Yes.
you sit on the floor. So all these things are requirements from either your cultural or religious thing,
Mm.
which
Mm.
actually require you to bend the knee. Whereas
Yeah.
Westerners do not sit on the floor.
Yeah. Yeah.
That's
That's
one of
true.
the reasons.
Like duduk bersila.
Yeah, duduk bersila.
Mm.
All these are all part of normal day activity for us.
I see. Okay. Yeah. That makes
Next slide.
sense.
Now, eventually, the cream doesn't work. So then the
Mm.
most popular drug everywhere in the world, Panadol. All right. If you have knee pain, one of the safest drug you use is paracetamol or Panadol. All right. This
Mhm.
actually helps you to reduce pain. It's quite safe and actually gives you good relief, no matter, even though it's a very simple drug. The other
This is
drug
over the
available
counter lah.
is over the counter. There
Mm.
are a few drugs which are also over the counter, like anti-inflammatories, which you may be able to get, but
Yeah.
these are drugs which got other side effects, including kidney failure and gastritis. So you have to be careful when you take them.
Okay.
Next slide. And over the years, people have got better and better painkillers. So there's something
Mm.
called COX-2. They have drugs like celecoxib, valdecoxib, many of the new drugs. And these
Mm.
drugs, even though they are good painkillers, they have lesser
Yeah.
side effects. Now,
Right.
again, painkillers always have side effects. So only
Mm.
take them if necessary. The newer painkillers, even though they got side effect, are lesser.
Okay.
Okay. Next slide.
Doctor, when you are suffering from arthritis and you've got uh, two questions regarding the pain. What is the extent of pain that is that 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 an arthritis patient suffers. And then the other question is, is this pain consistent? That means, is it like round the clock, or does it come and go depending on if the aircon is on, or depending on if you've just been walking?
Okay, first of all, the pain duration. This is a
Yeah.
mechanical pain. That means
Mm.
it happens when the joint moves. So a person, just say you're sitting down having dinner, no
Yeah.
pain. The moment you
Mm.
stand up and go to wash your plate, you have the
Mm.
severe pain. Just say you take a drive from KL to JB. During
Right.
the drive, no pain, but the moment you Johor Bahru and stand out the car,
Mm.
it's very
Mm.
painful. So this is a
Oh,
mechanical pain. All right. And the pain
okay.
is usually worse when you move the joint.
So chances are when you're asleep, it doesn't really bother you at night.
Does not.
You're
But if you start kicking in bed, many people kick in bed or turn here and turn there, and you move your joint, that wakes you up from sleep. So one of the reasons you have night pain is because when you wake up from sleep because of movement, it tells you that you may have osteoarthritis.
Okay. And what's the extent of the pain? If you were to, because they have like pain indicators now, 1 to 10, with all the smiley faces. Painful is arthritis.
Okay, so we know how painful it is. The most basic one, 1 upon 10. The most severe, probably about 7 or 8 upon 10. But
Okay.
again, arthritis is a quality of life problem. That means it is not your pain, it's your quality of life. Just say if I have knee pain and go
Yeah.
for shopping today, I would say, no, my knee pain, I'd rather sleep at home and rest myself.
Yeah.
It's a
Yeah,
quality
that's
of
right.
life. So when your quality drops, that means you're stopping things because of joint pain, then it's
Yeah.
time to start treatment.
Yeah lah. Otherwise, yeah, you won't want to socialize.
Correct.
Yeah.
So
And have to
yeah,
go to work and all that.
exactly. And we can actually improve it faster. Let me show you next slide.
Okay.
Okay, so I mentioned earlier that in the slide, this is a normal joint,
Yeah.
and this is a joint which is worn out. All right, it's worn out here. So when the joint is worn out, what will happen is the bones rub each other. So if
Yeah.
you put oil or lubrication in the joint, it moves better. All right. For example, this is actually a lubricating oil, which actually if you inject into here, it will give you extremely good pain relief. All right. Because
Okay.
when oil is put down here, it's like putting minyak, like putting WD-40. The people spray the
Yeah. Right.
WD-40. Yes. So it's something like oil for the joint. It maintains the joint to be smooth again, so less painful. So kalau taruh minyak pada sendi, it helps better. Pain is also lesser.
So that's what the injection.
That's what injection is for.
Oh, I see. How long does this last? The
Okay,
lubrication.
the lubrication lasts up to 1 year for a knee which is slightly damaged. The blue one does. And maybe 6 months to 3 to 6 months, it is not so good. Depan belakang dia. I show you the example.
All right.
This is how an oil will look like again. Sorry. So you look at this here. This is how lubrication is. If you look at it on the slide here, you can actually see some of them, the ball moves very fast, some of them, the ball moves very slow. So the thicker the lubrication, the better it moves, slower it moves. So the joint is better. So the quality of oil in your joint, we have injections of different qualities, which gives you longer lasting effects. Thank you. Next slide. I must say that a lot of people believe in massage, urut, acupuncture, and they do help a little bit because they help to reduce the pain and also some ways reduce and improve the quality of life. So these are alternative methods which we don't really do, but also use by patients which actually help reduce their pain and better quality of life.
Yeah.
Okay, next slide. Unfortunately, not everything worst come to worst. Sometimes some things don't work as you plan, and that's when we need to do surgery. Okay, for example, let me show you first slide. Okay, sometimes we need to take out the loose piece of bone. Sometimes we need to take out pieces of bone or the extra piece of bone and joint. And these are different kind of surgeries which we can do to improve the quality of life. Next slide. Okay. So the first surgery, make 3 small holes or small holes, 2 or 3 holes, put a camera inside and look inside the joint and wash it out. Just like if you pindah rumah, the first thing you do in rumah baru is to clean the house before cat. So putting the scope is to clean up the house, make the joint smooth, and then after that put a pain like taruhkan gel. So these two will reduce the pain for the patient for at least a year. Okay, this is called arthroscopy or keyhole surgery.
Okay. When you do this pinhole surgery and you actually have things to remove, how do you remove them? Like, is there some sort of vacuum to
Yes, because there are two holes. The first hole is a camera. The second hole is a vacuum. Yes, you're right. It's a vacuum cleaner which actually sucks all the bad part of the joint. So it's like cleaning the whole joint by a small little hole. So patient don't worry a big cut, a small cut, but it helps you to heal faster.
I see. Okay. All right.
Next slide. Okay, so this is how a keyhole surgery look. You can see there are two small little pins into the knee joint, and these are all done under anesthetic, so the patient has got no pain at all. All right?
Yeah, orthopedic surgery is wow.
It's always under anesthesia. All right, next slide.
Definitely everything is, but it's just more orthopedic. It's just like wow.
So we have a camera inside. Yes, you're right. This is a nice little camera showing the joint inside. Next slide. And you can see this is the vacuum cleaner which is there and trying to clean up all the debris which you see inside the joint. All right.
Yeah.
And you can see after cleaning up the pieces of bone which have all been washed out, so it's a bit more smoother than before. It's not a cure. Yeah. It's better than before, but patient will feel the improvement. Next slide. Right. Okay. Next one. Now, after you clean, I talk about arthroscopy is like retreading a tire. Tire sudah botak, I sent to shop retreading. So it's still the original tire, but still not perfect. But when tire sudah botak, the first thing you do, tukar tire. So do a joint replacement. That means you take away everything which is damaged from here, totally damaged, and replace it with a brand new metal and joint. It looks like this. You can move a bit more smoother. This is how it looks like. So look on the side.
Must be metal
and straighten. There are three parts: the metal, the plastic, and metal. This enables a joint to move as smoothly as possible.
Okay.
Next slide. All right. So you can see on the left side a damaged joint with all the spurs, the extra bones, the tissue flying around. And the right side, we threw away everything is damaged and put in a brand new metal, plastic, and metal. And this is called a knee replacement.
Okay.
Next slide. All right. So there are three parts you asked me just now. The top metal, plastic, and metal. These are standard anywhere in the world. The basic principle is so that the top bone and bottom bone don't touch.
Yeah, but
don't touch anything.
Contraptions memang it has to be metal lah. There's none entirely of plastic.
Unfortunately, plastic doesn't last long. Metal lasts longer. So a knee replacement like this gives you about 15 years of pain relief if done well.
Okay. Even for the elderly?
This surgery is only for the elderly. It's only for the elderly. Not for the young. Only for the elderly because it lasts you only 15 years. After 15 years, you operate again. So it's only done for the elderly, not for the young. Unless on certain reasons, I'll show you later. Okay?
Yeah.
See the knee
joint?
I
got another question stemming from that picture just now. If you have had that kind of surgery, sorry, what do you call that surgery? When you actually...
A knee replacement surgery.
Knee replacement surgery. If you have had that, would you be able to carry on with your mobility like before? For example, walking, running?
The idea of doing surgery is to bring your quality of life. So when you cannot walk, if you put a knee replacement, you can continue going, you're shopping, you're walking, maybe a little bit of running. But it's purely for elder people who need a bit of walking, activity to keep them mobile, and so they're not stuck at home.
Okay. All right. So it doesn't mean just because you have this, you can immediately jump up and start doing Muay Thai or something, no lah.
Okay. Again, nice question. Let me just put in the car theory. After I changed the 50-year-old, 20-year-old Proton Sagas tire, the tire is brand new, but the engine is still the same.
Okay.
So I don't change a person. I only change the tires, which means the knee is younger, but the whole person is still old. I can't change the age. I can only change the quality of the knee joints, like a tire. All right.
Okay.
The pain is
Right.
lesser. They're still not as healthy as they were when they're 20 years old.
Mm.
Okay.
Okay.
Next slide. All right. So this is a replacement done. You can see now there's big white things down there, and the two bones you see are now not touching each other. And this is what you call a knee replacement surgery, where two bones are far away, not touching each other. Therefore, they have enough space for the joint to move.
Doctor,
Next slide.
the white, those are, is that the bussy thing that you were showing just now? Or
Yes, that means if you look at it
yeah.
again here, the
All
bussy
right.
things is what you see in X-ray. The plastic is a black area in the center you cannot see. The plastic keeps the bone apart. That gives you the pain relief.
Yeah, this will definitely make the metal detector alarm go off lah.
Yes, if you go on an airline, that will definitely detect the metal. And we normally give you some cards to identify yourself that you actually have a knee replacement in your body.
Right. Okay.
In your wallet. Okay, next slide. Okay, so you can see this patient on the right side. You can see a scar line on the knee. That's a knee which has been operated on. The left side hasn't been operated on. So the knee after operation will become straight. Can you see the right knee? Can you see that? The picture right knee is a
Yeah.
long line on the knee joint. That's a knee that haven't been operated. That knee has been operated. So the knee replacement will correct your deformity. So you're no more bengkok, you'll be straight.
But
So
arthritis until it gets to this stage is already like very, very bad lah.
you do not know, many patients will wait until it's very, very bad.
Yeah. Okay,
Next
that's
slide.
a lesson to learn.
That's a lesson to learn. Yes, don't wait too long.
Go and see Dr. Yoga straight away.
In later, as you get more modern, we have actually computer-assisted surgeries. For example, we have got computers which actually help you to do a knee replacement. Next slide. All right, so this is an operating theater. You can see a big machine there, which is like a robot, which actually looks at the surgeon and make sure you make the correct surgery ways by telling you how precise your surgery is. So the more accurate you do, the more precise your surgery will be. You said like go to a car workshop, wheel balancing, same thing, knee joint is balanced properly. Next slide. So these are all available. It tells you how much you bend, how much you can straighten, so you can actually plan for the patient to have good range of motion after surgery, so they can sit on the floor, basila, sembayang, all can be done if it's done properly.
If anyone goes for this particular type of surgery, how long will they be in the hospital and how long will it take for them to recuperate?
They need 5 days, 3 to 5 days in hospital. They need 2 months so that they are totally independent.
I see. Okay.
Next slide. All right, this is just a picture showing the operation. Next slide. And after surgery, we bandage up fully. Okay, there are many things that we can do. Next slide.
Ada holiday picture ke?
That's actually, go back one more slide. Yes, let me show you. That's actually one of my training centers. This actually is a hospital. The whole hospital is in Italy, Milan. And this whole hospital is only an orthopedic hospital. We only do orthopedic patients alone. That means all the 8 tingkat is purely orthopedics.
I see.
Okay, so they have certain countries have only one department, one hospital. Okay? So when you ask me about whether any other joint can be involved, yes, you can also have a hip joint involved. Next slide. So this is actually a young boy. I did tell you that only for old people. This is a young boy. This young boy actually had an accident, and at that time he broke his hip joint. If you look at it on the left side, the hip joint looks very abnormal, whereas the right side is a normal side. Next slide.
All right.
And when you see it, the first you can see is the leg is pendant and look not normal. This because the hip is broken, the leg became shorter. Right?
I see.
Next slide. So we found during surgery, this is the ball of the hip, which is already damaged. You can see it's already red, even though it's a young guy. Next slide. And we replaced that with a brand new metal and plastic. Next slide. Right? And you can look at him now. Both legs are the same length. All right? So you don't do it for young people, but for certain people due to injuries that cannot be corrected, then we do a hip replacement to make it better. Next slide. Okay. So you can see him walking. Next slide.
Tall guy.
Tall guy, yes, and he can walk better now. Right? Next slide. Okay, now to go back to
This
the
is good. Yeah.
very
This is
important.
very
I told you
important.
again,
Everybody needs to pay
the
attention.
first thing I told you today, the take-home message:
Yep.
healthy weight.
How to
Don't put on
prevent.
weight because it's very hard to lose it later. So a healthy weight is important throughout your life, so you don't damage your knee so much. If possible, 2 times or 3 times a week, go for some exercises, something that you enjoy doing that you can do it regularly. Don't do for 1 month only. Do something you can do it long term, not short term. Okay. Things
Cardio
that,
exercises?
yeah, it's good for you if as long as your joints are okay, you're healthy enough. Yes, you can do it. But
Okay.
if you have pain, your body is telling you something's wrong. Don't push it.
Okay.
And of course, things that are doing repetitive, see people like skydiving, jumping up the cliff, coming down, which are extreme sports, may not be good. And
Okay.
like anyone else, as you grow older, you have to slow down a bit. Don't do things you're doing when you're 20 years old now because you will pay the price next few days or next few months. All right, next slide.
Doctor, I see the word stretching here. So this means yoga is okay?
Yes, stretching is okay as long as you don't have the pain the next day. You can stretch out. You have no pain. The joint is not painful or just mildly aching is fine. But you find the knee is painful as you do it, it means there's a limit for it. You can increase slowly, but don't push it suddenly. Don't be a hero in one day.
Okay.
Okay, this is me and a few doctors in New Zealand where we actually did a hip replacement and there's a
Oh, that's
space.
true. In the middle.
Yeah, that you can see me. And that's in New Zealand actually, the one next to the patient.
I
Right?
see.
Next slide. All right. Thank you.
We're done. Thank you so much, Doctor. That was really interesting. Okay, Doctor, we've got quite a few questions here actually.
Okay.
Okay, let's take a look at our first question. We've got our regular Mr. Barjish Paul. Everyone giving you a thumbs up. And
Oh, thank you. Thank you very much.
okay, yes, we have a question from Mr. Barjish Paul. Is there a possibility that runners or athletes lose their cartilage earlier than normal walkers? I'm not sure.
Yes,
I think it's supposed to be
athletes
code
usually
LISE.
they do a lot of activities. Some of them strenuous. Yes, they have an increased risk of osteoarthritis because of wear and tear. It doesn't mean that they could have done it during the races, but most of them, after a few years, stop exercising. And I noticed that the best athletes, when they stop exercising, become the worst patients because they put on so much weight and they maintain the same lifestyle. So in some ways, they are very good when they're younger, but as they lose the activity level, then when they put on weight, it becomes worse.
Right.
Sport is very, very good. Do not stop it. But I think it's important that you maintain a healthy diet, healthy activity, and no extreme sports that will maintain your knee joint as long as possible. And remember, the original knee joint is better than this one. All right? You have original, it's better than this.
Yeah. Okay. I hope that answers your question, Mr. Barjish. Yeah, I just note that you actually noted the typo. Anyway, okay, so we're done with that. Mr. Aston Clarence is asking, how can you lessen the pain and can you keep eating constant painkiller? Okay. Can you depend on painkillers lah, basically?
Okay, first of all, to lessen the pain, let's look at the non-medication first. That means, first of all, if possible, use a better shoe, use a knee guard, don't squat down, don't run when you can walk, don't walk when you can sit. That's when you have osteoarthritis. Now, Constant is a very good old painkiller and is meant for short term. Osteoarthritis is a long-term problem. If you take Constant early on in life or early on, by the time a few years come, you'll have a second problem. You either have a gastric ulcer, a gastric bleeding, or a kidney which is failing. So, if possible, try the non-medication part, either the ointment or the exercise, the weight loss, the shoes, all right, and reduce the damage in knee, and take Constant or any painkillers very rarely, if possible. If you need Constant every day, see a doctor if there's a better option that you can use rather than painkillers.
Right. Okay, doctor, there's a question here by Ms. Karen Lim, but it's regarding ACL. I'm not sure what that is, and I'm not sure if that's got to do with arthritis. Maybe you want to address that very briefly?
Okay, ACL, thank you. Sorry, this is not arthritis, but ACL means anterior cruciate ligament. In every knee joint, there is actually a ligament, and this is a knee joint here,
Yeah.
and the cartilage, which you talk about. But in the center, there's a ligament.
Mm-hmm.
That ligament, you can see in the picture, is almost partly torn. That's an ACL.
Yeah.
So the ACL keeps the top bone and bottom bone connected. If the ACL is torn, the knee will be not stable, right? So to prevent an ACL injury, first of all, you must participate in sports which you're ready for. For example, footballers, when they knock each other, they can tear the ACL. So if they have strong muscles, that will support the ACL better. So avoid sports which actually would cause a lot of damage if you're worried about it. But building strong muscles will reduce the risk, and proper game methods, means don't cheat, use a proper way to tackle patients, other sportsmen. So follow the game rules properly to reduce the injuries that occur during the game. That's the only way you can stop an ACL injury. Okay? Prevention and proper rules of the game.
Okay. All right. So we just move on to the next question. Sorry, I was just going through the questions. Nur Daniel Ibrahim is asking, hi doctor, does cold water affect your joints when you get older?
Okay,
How
you're
some
right.
people like mandi air sejuk kan? So does that?
Yes, I know, you're right. I see, when you have cold, right, sometimes due to the temperature change, the warm joint is warm, and you put something cold, the blood supply may suddenly be reduced, and patient may feel a bit more pain, and therefore they feel a warm butt may be a bit more better for them. This is all the perception of pain. It doesn't prevent the disease, but it makes you feel better because when the nerves have different temperatures to them, they work differently, and the pain is lesser. So the correct answer is like this. So for some people, the cold water works. Some people doesn't work. The idea, if it's no pain, that means it's good for you.
All right. Okay. But I mean, overall, I'm not sure if that's got to do anything with arthritis or if it can cause arthritis. If you mandi malam or if you mandi air sejuk, things like that, and people say, nanti tangkap sejuk or nanti sakit tulang. So how far?
Okay.
Is that true?
Thank you. That's a very important question. The mandi panas, mandi sejuk, mandi malam doesn't affect arthritis. But if arthritis is already there, already you have arthritis, then making something cold may cause pain. So it doesn't mean because mandi sejuk dia sakit. It's because you already have the disease, that's why it's painful.
Right. I see. Okay. Here's another question. This is by Encik Fakri Hamzah. Is there any side effect for the hydroluron injection?
Okay. Every procedure has side effect. When you inject minyak or hyaluronic acid, very correct way to say, there are a few risks that involve. The first risk, because it's a liquid and you inject from outside, there's about 4% risk of infection, number one. Number two, after injection, most patients will feel a knee a bit tight or stiff for the next 2 or 3 days. In very rare patients, you may have allergic reaction. After injection, the knee is swollen up. There's a complication that may also get it. And of course, the one which patients don't like to hear, sometimes it doesn't work. So after injection, the knee pain is still there. Then you have to look for other methods.
Yeah. Okay, we're going to take 2 more questions. All right, this is from Miss Pauline Yap. If I feel hot at knees after exercising with no pain, no swelling, is it a sign of cartilage reducing?
Not really. This is not like a tire. You walk around, it warms up. No, not really. But when you do exercises, there's more blood flow to the body, the lower limb. Your leg will feel a bit warmer. That's normal. But what will be not normal if the knee is swollen or painful or difficulty moving the next day or the same day itself? That's not normal. But feeling warm alone, it does not mean osteoarthritis alone.
Okay, all right. One last question from Ms. Edita. Good afternoon, Dr. Yoga. If previously I was having ACL and PCL tear, what type of exercise can I do, and any suggestions? Thank you and have a nice day.
All right. First of all,
what's PCL?
Sorry? Okay. Again, we talked about ACL, which means the ligament in front is ACL. But in the back of the knee, There's also another ligament. This is called a PCL.
Posterior. Okay.
So posterior cruciate ligament. So it's anterior cruciate ligament, posterior cruciate. Both of these ligaments are working in tandem to keep the knee stable.
Okay.
So if you're young and the knee is unstable, then doing a surgery to correct the ligament or repair the ligament may make it better for you to make the knee more stable. Right?
Okay.
Exercises alone may not help you because two ligaments are torn. So you may need to do surgery to improve the quality of the cartilage, the ligament, so your knee is not unstable. So in the future, you may not go on to osteoarthritis.
Okay. But what kind of exercises can this person do?
Normally, we actually do the quads and hamstring strengthening. That means you strengthen the muscles of the thigh, the front and back, so that they become stronger and prevent the knee from wobbling when you walk.
I see. Okay. Okay, I think that's all the time that we have for today. I'm just quickly browsing through the questions to see if there are any questions that's really strong about arthritis. But yeah, okay, I think we need to wrap it up actually. And it has been a very, very interesting session. Thank you so much, Dr. Yoga Raj from Columbia Asia Hospital, Iskandar Puteri. He's the
Thank you very much.
Yes, the Consultant Orthopedic Surgeon. Thanks for your time. Hopefully we can do this again and we can take a look at the other topics that we mentioned earlier.
All right. Thank you so much.
Thank
Bye-bye.
you. Thanks, everyone. Bye.